today's session is about first aid. Already ma'am told. So you can make a difference and save a life if you know the first aid. So let me ask you some questions. So can anybody tell if anyone in the assembly, if they immediately feeling dizzy and if they fall, what will you do? What the help you can do immediately? Yes? Or if anybody injured while playing football on the ground, because anyway PT period is there, you are going to play every day, isn't it? Yes. So what help you can do? You can go to wellness room. Before reaching wellness room, see, from the ground to the wellness room, even I went to your wellness room. You have to come in the lift and then, so before reaching some help you can do there, isn't it? Yes. So that is known as the first aid. Okay. What help immediately, what we can give, that is known as first aid. So what is first aid? Already ma'am told, first aid is the immediate help which is given to the sick person or injured person before it reaches the medical help arrives or before we reaching the hospital. That is known as first aid. So you can tell now, right? Yes? First aid is the immediate help given to the victim or given to the sick person or to the injured person before we reaching the hospital or before the professional help arrives. That is known as first aid. Okay. So next is 3 R's of basic principles of first aid. So for the first aid, so we have to know the 3 R's. That is, first we have to recognize what is happened there. Then we have to resuscitate, and next is we are referring the patient to the hospital. This is the 3 R of the first aid. So no need to learn detailedly about this. Now this is important, that is goals of first aid. So why we are doing first aid? To preserve the life. So in the case of, do you know heart attack? Yes? Yes, right? Cardiac arrest, heart attack. Maybe in 6th standard you heard about that. What it is, no need to learn, but you know whether you heard, right? What happened? See, heart is the main organ of the body circulatory system. If it stops, what it is? Death, isn't it? So if any person he is in the cardiac arrest, or we can do one method that is known as CPR, cardiopulmonary resuscitation. Whether you heard, whether you seen people are doing to the heart like this in the movie, or in the recently in the Stampede when Virat Kohli came to that, yes, Bangalore, the Stampede happened, and whether you are watching this TV, they are doing CPR. What is that? It is cardiopulmonary resuscitation. Why we are doing that? To preserve the life. That is the goal of the first aid. One is preserving the life, and next is prevent further illness. So I am giving you one example. If the person is falling on the ground and he got fractured on the leg, can we make him to walk from the ground to the wellness room? No, right? Yes. So by that we are giving first aid. That is the first aid in the case of fracture, and we are preventing the further illness. We are saving him from the further illness, and next goal is promote recovery. That is, we are giving some help to him and sending him to hospital, and we are reaching him to the wellness room or that, and we are saving him and we are promoting his recovery. So this is the goals of first aid. What is the goal of first aid? Yes, repeat. Preserve the life. Yes. Prevent further illness and promote the recovery. So you understood that? Yes. Now, ground rules of first aid. If at all you are doing first aid, what you have to do? You should be stay calm. That is very important. And you calm down and you have to tell the patient, one who fell down. See, he was worried. What happened to me? Then you tell him to calm down and call for the help, that is school authorities or ambulance if required, and communicate to assign the rules. See, if two of you are there, one boy fell down, then if you have to assign the rules, you have to call somebody else and tell them to go and tell to the teachers. You should not leave him alone. That is assigning the roles and control the crowd, because if breathing difficulty, if anything is there, the crowd is there, it will be more. So you have to make sure that crowd is not there. Now, 3 C's of first aid. So first aid, this is very important, 3 C's of first aid. That is check, call and care. So under check, so 3C, what is the 3C? Check. What we are checking, that I will explain you everything in detail. Then call for the help, and next is care. So check, call, care. Yes, repeat. Check, call, care. So you understood 3 C's of first aid, that is check, call, care. Then under check, we can remember Dr. ABC. Dr. ABC, D-R-A-B-C. Now I will tell you how to check each of this. Then first, what we have to do is danger. Under Dr. D is danger. So scene safety is coming here. So if at all the first aid, what we are doing to the person, he is under electric shock. So can we go ahead and touch him? No, yes? Yes, we have to take the stick, wood stick, and we have to get rid of the electric wire or switch off. Something we have to do, right? In the road and all, if it is any wire, anything, can we switch off? Where we were not knowing where is the switch. So in that case, we have to remove the wire. That is the scene safety. That is, am I and my team safe? Is the victim safe? Is the surrounding safe to go ahead and do some first aid? You understood what is D? Danger is there or not? Am I safe? Is the victim safe? Is the surrounding safe? That is what first you have to see. In the case of sports injury, in the case of school injury, it is okay. But in the case of drowning, again you have to check. Can you jump to the water? I wanted to see, ma'am taught me first aid. Wherever I am going and doing the first aid, can you jump to the water? No, right? So that is what first you have to check the scene safety, that is coming under Dr. ABCD. Next is response, DR, response. Now, the patient is awake or not, he is responding or not, that we have to check. Awake and responding, that is alert. When you call the patient, so he should be telling, okay, I am fine, or your name, that is known as alert. Next is voice, patient is responding to the voice or not. When he call his name or pat him on the back, is he responding? That we have to check. And pain, if then also if he is not responding, we can pinch on the shoulder. So that time he may respond quickly. That is whether pain respondent is there or not, we have to check. Next is if the patient is unresponsive, by all this, calling his name, patting on his back, pinching on his shoulder, if he is not responding, we can declare him as a unresponsive. So in the case of unresponsive, usually we are going, in that case, even the airways, breathing will be stopped, and the circulation, even the heartbeat is stopped. Then we are going to the CPR. CPR means cardiopulmonary resuscitation. Let us see, if the time permits, I will explain you CPR also. Let us see. Okay, so this is about the Dr. ABCR. You understood? Yes? So what is D? Yes, first. Danger. What is R? Response. So you have to check all this. Next is ABC. Airway, breathing, circulation. So airway, whether he is breathing or not. That we have to check. How we can check? Chest will be rising, and if we listen to his breath sounds, we can feel, right? Yes, you can feel some feeling will be there on the cheek if he is breathing. Next is listen to the breath sounds and breathing and pulse. Pulse usually we are seeing not on the hands, because hands it will be feeble, so we can see on the carotid pulse, that is on the neck. Okay, no need to learn that name and all complicated. Just you can put the one pulse we can feel here also, that is easy to feel on the neck rather than on the hands. So by that we can understand whether his circulation is correct, whether he is breathing, is his airway is proper. If in the case of choking, what will happen? The airway will be blocking, isn't it? So we have to check the airway, breathing and circulation. That is known as Dr. ABC. You understood? Yes? So now I told 3C in the beginning. Do you remember 3C? Yes? So first one is check. Next one is call for the help. So call for the help, you have to identify the situation and call for the ambulance or call for the teacher. That is coming under call for help. No need to learn very detailedly about this. This is bar, no need to learn. Just call means informing the authority or informing the ambulance or hospital. Next is care. That is perform the first aid and shift the patient to the hospital. That is the care you are giving to the person, isn't it? For the first aid, to do what you need, that is presence of mind and little knowledge about first aid and quick action. That is the first aid you are doing and saving the life. So perform the first aid, transfer to the advanced medical care unit, that is known as care. So you understood 3C? What and all? Yes, can we repeat? Check, call, care. Under check, doctor. That also you understood. Then call, you have to call, and this is care. We are giving the first aid and transferring the patient to the hospital. So you understood 3 C's of first aid. Now you understood what is first aid, goals of first aid. What is the goals? Yes, preserve life, prevent injury, promote recovery. Then you studied 3 C's of first aid, that is check, call, care. Okay, now this is important, how to move a sick or injured person. See, imagine one boy fell on the ground while playing football and his leg got fractured. Can we make him walk? Yes? No, right? So transferring the patient or shifting the injured one, that is very important. In the case of neck and head or spine injury, you have to stabilize head and neck and then transfer the patient. That is also important. Then while shifting the patient also, while you can bring one bed sheet or any blanket, then roll the patient. That is also important. And using the stretcher once the ambulance comes. So that and all no need to study. That is for adults, that is okay. Anyway, you are not shifting to what is the first aid that you can do in the school. Let us learn that only. So shifting the patient is also very important. And if injury on the leg, don't make him or her to move or walk. Call others to help and lift them or make him to sit in the chair. See, that is the way. Or you can carry like this, one person transfer. So this is the way you can shift the patient from the place to the wellness room in the school or to the ambulance or anywhere, wherever the safety place you can transfer. So this is about the introduction of the first aid. So any doubt in this? Or can we move to one disease? Yes? You understood? Yes, right? You can openly tell me if any doubt or anything you can ask me. Yes? So we will move on to common emergencies, first aid in common emergencies. So I am going to teach you like one by one. So this some of the common emergencies which is encountered in the school. Can you name anyone? Anyone? Yes? It is there already? Yes. Bleeding. Yes, right. Then fracture. Yes. Then next, some bites will be there. Yes. Then electric shock, burns, drowning, breathing difficulty in the case of asthma especially. Yes. That is breathing difficulty. Seizures. You know seizures? What is the other name? Yes? Shaking of the body and falling on the ground. Yes? Fits. The common name is fits or epilepsy. Yes? That is one. Seizures, choking, cardiac arrest. So all in these cases, what first aid we can do? Let us discuss here. Okay. So first, coming to the bleeding. Do you think the minor bleeding is an emergency? No, right? It is not emergency. So it is like we can treat at home. So what we can do in the minor cuts? See, sometimes you may chopping vegetable or cutting fruits. So if the minor cut happens, what will you do? Yes? First what we will do? No. Wash it. Who told that? Yes. Wash with the soap. That is the first aid what we can do in the minor cuts. Go, wash the wound, then apply pressure. Whether your parents or grandparents, they were telling, no, see, apply pressure and raise your hand. Why we are raising the hand? Why we are raising the hand? Yes. To reduce the blood flow. Because why we are raising above the heart level? Heart is the main organ of circulatory system, and we are raising our bleeding part above the heart. If injury on the leg, we can lie down and raise the leg so that the bleeding won't stop, but it will reduce. So in the minor cuts and wounds, what we can do? We can wash the wound or cut, then apply pressure, raise your hands. So how many minutes we have to apply the pressure? Not like 2 seconds you will apply and you will see, whether the bleeding is stopped or not. Are you doing that or not? Yes, right? You won't apply pressure, you have to apply pressure continuously for 3 minutes. 3 to 6 minutes, because some things are there, bleeding time, clotting time, no need to learn, but apply pressure 3 to 6 minutes so that the bleeding will stop. So what you can do? Wash, then apply pressure, raise your hands. This is in the case of what? Minor cuts. Now after that, if the wound is deep, still the bleeding is not stopped, you can put the bandage and go to the hospital to do suturing or stitches. Yes. That is the case. But in the case of uncontrolled bleeding, if the injury is very deep, if the blood is coming, can we drag the patient to wash under the tap? No, right? So what we can do in that case, that is first aid in the uncontrolled bleeding. That is locate the wound. Because blood is gushing. From where it is coming, we don't know. So we have to see from where it is started. Locate the wound is the first step. Then apply pressure and apply the tourniquet. So do you know tourniquet? Yes? Whether you seen in anywhere? Yeah, can we do it here? In the case of uncontrolled bleeding, so what is the first thing? You have to locate the bleeding. Then you have to apply the pressure. Still the bleeding is not stopped, means till the medical help arrives, what we can do is applying the tourniquet. So can I do it with you? See, if the wound is here, so where we have to apply the tourniquet? So 2 fingers above the wound. Yes? No, okay. So you have to apply the tourniquet. I cannot do in this scale, but still I am showing you this. See, first you have to put a knot like this. Then again you have to put one more knot. Then you have to see, not this small scale. You can take any stick which is not breakable, or the long scale, or the wooden scale what we are using in that that is good. Or any like pipe or anything you can take. So you can put it like this. Then you have to tie it this. Then we can turn this. You have to do underway and you can bring it here. From here you have to bring it underway. We can tie this. So this is the first aid. This is the tourniquet we are doing in the case of bleeding. So what will happen is the blood flow will be arrested, or it will be reduced so that the bleeding may reduce till we reach the medical help. Can we tie tourniquet for more hours? No. We can tie tourniquet only for, thank you ma'am, only for 2 hours. After that, if we are not reaching the hospital, we have to stop. We have to release it. Yes.
Ma'am, if you don't get a stick, pipe or something like that, you can just tie it around.
No, just tying, what will happen is it won't be tight. Why we are applying stick is one thing to make it tight. Otherwise, only with the veil or only with the dupatta or any cloth, if we tie, that tightness won't come. Why we are applying that stick and we are turning it like a tap, so that that tightness will come. So if it is not available, what first aid, what you told is correct. You can apply only that. But if it is readily available anything, we can use this method. So in the case of uncontrolled bleeding, that is, one is, tell me the answer, locate the wound. Yes? So you understood in the case of bleeding, minor cuts and wounds, what you have to do. And in the case of uncontrolled bleeding, you understood? Yes? We'll go next. Okay. Next, coming to the head injury. So this is also common in the case of playground while playing football, isn't it? Yes. So head injury may be minor bumps to the severe injury to the head, scalp, brain, anything. Minor head injury, some bump. Maybe you experienced, isn't it? Yes. Hitting your head to desk or other's head. So minor bump. In that case, no need to worry. Just apply the ice pack. That is enough. And if the bleeding is there, you can do the first aid for bleeding. But when the head injury is emergency, when it is emergency is, you are losing consciousness, then breathing difficulty will be there, then prolonged disorientation. Oh, where I am standing, is it school or home? So that confusion will be there, and feeling of vomiting, that is known as nausea and dizziness, headache and fainting. All these are the emergency situation in the head injury. So in that case, you have to shift the patient to hospital. And so first aid, what we can do in the school or anywhere is, if excessive bleeding is there, you can compress to stop the bleeding and rest without moving. You can make the skull and head, the immobilize, and then if he is unconscious, no breathing, no pulse, then you can start CPR in the case of head injury, or else you can shift the patient to the hospital. Nothing, no first aid, immediately we can give for the emergency head injury situations. What we can do, we can help in this way only. That is, if any bleeding, apply pressure and stop it. Then rest, moving without skull and head. Skull and neck. We cannot immobilize and shift the patient. And if the patient is unconscious, so when we should do CPR is no breathing, no pulse. In that case only we can do the CPR. So what is the CPR full form? Cardiopulmonary resuscitation. That is CPR. Next is the common things which is happening in the schools. That is fracture, sprain and strain. What is fracture? Yes. What is fracture? Yes. Breaking of the bone. What is sprain? Yes. Ligament. Ligament tear is known as sprain. Strain. Strain is muscle or tendon tear. Okay. So sprain is ligament tear and strain is muscle or tendon and fracture is bone. But in all the cases, symptoms will be same, isn't it? You cannot diagnose. Once the one kid is falling on the ground, can you make it out? Is it fracture? Is it sprain? No. First aid, yes, first aid is same for all this. So once you go to the hospital, once the X-ray is done, then only that diagnosis will happen. So what is the first aid in this case? See, all injuries are suspected to be fracture unless proved otherwise. We cannot confirm, but we can make out sometimes. Sometimes what will happen is full bone will crack and the limb may be shaking. In that case, we can prove, oh, it is fracture only. But we cannot confirm. In the case of children, the bones are growing. They are more flexible. They have a soft area of cartilage at the end of their bones. So we have to take care more. So what is the first aid in the case of fracture? That is, remember, rise. Rise. Easy to remember in the case of fracture. What you have to remember? Rise. What is R? Rest and immobilize. Already I told. So if it is leg, don't make him to walk. If it is on the hands, what we are doing? We are putting the sling. Isn't it? Yes. So that is rest and immobilize. Next is ice application, because swelling will be there. We have to take the ice and wrap it in the cloth, and ice application you can do. Next is compression. What is this compression? Yes? So, do you know the crepe bandage? That pink color bandage? Yes, right. If any minor swelling is there, till we reach the hospital, we can do that. That is the compression. Next is elevation. If the injury on the foot, we can raise the foot while going on the car. We can put the leg up and we can, so that is elevation. That is known as rise in the case of fracture, sprain, and then one more thing what we can do is, see, this is the sling. Take one cloth and opposite end we can take and we can tie the sling, and splint. If anything, if any scale or anything, whatever available, we can give the support in the case of splint. And in the fracture along with bleeding, if it is there, what we can do? Don't disturb the bone if it is coming out like this. So surrounding area you can put pressure to control the bleeding. So this is in the case of fracture with the bleeding. You can apply the pressure on the surrounding area and shift them to the hospital. So you understood fracture, sprain and strain. Yes, right? Okay. So what we have to remember? Rise. Okay. What is that rise? Rest? Yes. Rest. You had breakfast? Yes. Rise? Rest? Ice. Then compression? Elevation. So you understood rise. Now coming to the insect bites. Insect bites or any allergy we can deal together. Yes.
If the insect or something is poisonous, we can tie like cloth or something tightly to the hand.
No need. No. It won't help in any way. Even in the snake bite also, it won't help. So that I will tell you. So insect bite. So what will happen is, small insect bite, one honeybee, that is okay. Mild swelling, little bit itching, swelling, it's gone. No problem in that. But in the case of so many honeybees are coming and biting, so what will happen? Immediately swelling on the face and difficulty in the breathing, dizziness will be there and confusion. So in that case, what we can do is just check for airway, breathing and circulation. If make the patient calm, make him lie in the comfortable position. If breathing difficulty is there, you can make him lie down in the propped up position and shift the patient, because we cannot do anything. But in the school scenario, in your wellness room, some medicines will be there that only the nurse or doctor can give. If it is administered, it will be arrested. So in that case, you cannot do anything in the case of insect bite if the anaphylaxis shock is there. Mild swelling, you can apply ice pack and you can apply some ointment. One insect, that is okay. But in the case of so many insects biting together, because whole honey that, you know that honey bee, this, yes, so many will be coming and honey, yes. In that case, if the swelling is there, if the rashes is there, swelling on the lips, swelling on the tongue, swelling on the throat, then what will happen? It will arrest the breathing. In that case, only calming down the patient and making him lie down or sit in a comfortable position, shifting as soon as you have to shift. But if the pulse, breathing, both are not there, you can do the CPR. So that is about insect bite, severe allergic reactions. So same in the case of food allergy also. Maybe some kids or somebody will be allergic to hazelnut. Somebody will be allergic to peanut. Yes, whether you heard. So in the case of food allergy also, if the symptoms are swelling in the face, swelling in the and full rashes, that is also emergency. Shift the patient immediately to the hospital. But what you are getting if you eat outside food, previous day you are eating outside food and next day you are getting stomach pain and 1 or 2 times vomiting. That is not the emergency case. That it will subside at home. That we can call it as food intolerance instead of food allergy. Yes. Next is snake bite. This is not needed much, but sometimes you can just learn what we can. So bites by venomous snakes can cause acute medical emergency. See, so many 3,000 more species of snakes are there, but only 70% are venomous among that. Okay, but we don't know which snake bit us, isn't it? So what is the thing? What just remember in the case of snake bite, right? In the case of fracture, rice. So in the case of snake bite, it is right. What is right? So rest. Don't make the person to run, walk here and there and make him panic. That is the first thing. Give him rest and immobilize. Immobilize is don't make him move too much and get to the hospital and tell the doctor. What is telling the doctor? Yes? Yes? Huh? Yes. If? Yes. But one more important thing you have to tell. What it is that? Yes. Very good. What we can do? So can we run behind the snake to catch and show it to the doctor? No, that is not possible. At least if you have mobile, what we can do is click or do one video recording. Then because each and every snake, the treatment is different. Venomous snake, the treatment is different. So it is very easy to the doctors if you tell them what happened to him. Symptoms also we can tell. Till he reaches the hospital, what happened? Vomiting is there. Is he feeling dizzy? And is he talking something like confusion or disorientation is there? That way you can tell. And also which snake. That is to tell to the doctor. So rest, immobilize, get to the hospital, tell the doctor. Then what about myths in the case of snake bite? What he told? Can we tie tourniquet in the case of snake bite? Never. That is, you have to remember, never tie the tourniquet in the case of snake bite. Because some places it is practicing even now. Why we should not tie? Because already the poisonous snake already bit, even it started to move to the circulation already, if you tie or not. And if you tie, what will happen? It will sometimes the area, the tissue in that area, cells in that area will destruct. And you cannot then regain that destruction. Cellular destruction will be there in that area. That is why you should never tie the tourniquet in the case of snake bite. Okay? Understood? That is the myth. What about then sucking and all? In the village areas they are telling maybe we can suck the poison through. No, right? No, we should not do anything. No need to wash the wound also. Just remember, rest, immobilize, and get to the hospital. Tell the doctor in the case of snake bite. No need to give him water or any food. Our aim is to go to the hospital. Again, while going to the hospital, we have to ask, call and ask, whether the snake bite treatment is available in your hospital or not. Otherwise, we are going to one hospital, running to other hospital. Is it possible? No, right? So that is in the case of snake bite. So now burns. So what we can do, usually you can tell what about your opinion. You tell about burns. Yes. Yes. What we can do? Applying paste? No. Huh? No. Washing, what you told is putting under the running water. For how many minutes? No. That is not enough. No. See, you can put till that burn get over. That is around 10 to 20 minutes. You have to put it under the running water. So in the case of burns, what is first thing is, again we have to check the scene safety. That is very important. If the fire is there, can we go there? First we have to remove the patient from there. That is very important. And do not open the doors and windows. Why? If the fire is there, do not open. Why? Yes, and if the oxygen, again, if air comes, it will be more, isn't it? Yes. So we should not open. Remove the live electrical wire and switch off the power supply. In the case of electric shock and in the case of the burn, fire burns, it is same. Burn is same, isn't it? But we have to check what burn happened and we have to remove the things. That scene safety is very important. Then remove the clothes and jewelry if it is easy. If it is stuck in the skin, no need to remove that because it may bleed. That is why if it is easy, we can remove the clothes and jewelry, cool the burn for 20 minutes, not 10 minutes, not 2 minutes. Because once you put under water, remove. It won't help, again the blisters will come. Blisters, you know, that, yes, that it may come. So cool the burn for 20 minutes, cover with clean cloth or cling wrap or something, or anyway, home easily available is cloth. Okay, that too, not tight bandage in the case of bleeding. In the case of the burn, we have to do the just loose bandage and go to the hospital. Why we are doing bandage, loose bandage? To avoid any further infection we can avoid. So that is why we are doing. Why we are not doing tight bandage? Because already the skin destruction is there. No bleeding, no need to do the tight bleeding. So this is in the case of burns. Okay. Now electric shock already we discussed. Severe burns muscle. This is all symptoms. No need to understand. And what we can do is get rid of the source. I told already. Then check for the vitals. How we can check? Breathing, circulation, if everything is there. If not there, start CPR. If everything is there, we can make him in the recovery position and do the first aid what it is needed. Okay. Now, next is breathing difficulty, or we can tell in the case, where and all we can see, in the case of asthma, yes. So, sometimes allergic breathing difficulty in the schools, it will be there, right? If the weather is very bad, immediately dry cough will start and the breathing difficulty may start. So, gasping for air, flaring nostrils. Flaring means nostrils will be big. Then breathing, stomach area is sucked inside. That breathing you can see. And chest pulling in with each breath, irregular rapid breathing. These are all the symptoms, these are all the features we can see in the case of breathing difficulty. So what we can do? So this is not needed. Yes, see, this is the situation. It will be there. Gasping. Whether you seen any kids in the school or anywhere? Yes? Yes, so what we can do in this case? If somebody is doing the happening breathing difficulty, what we can do? Yes, we need to calm down. Yes. So, yes. stay calm and reassure and seat him. Can we make him to lie down? Huh? No, because in the lying down posture, again it will be very difficult to breathe. So always make him in a propped up position or make him to sit in a comfortable position, and we can give reliever inhaler if they are used to inhaler. Some kids are known asthmatic and they'll have that blue color inhaler. Whether you've seen, it will be there in the bag. When we can ask them, are you taking the puff, that inhaler? If you are taking, if it is there, we can help him to give him, and we can give him too. But you cannot give. If somebody's inhaler, we can bring, can we give them? No. In that case, you should not give anything. Monitor, support, and we can shift. What we can do in the school is, we can shift him to the wellness room or infirmary, and some things we will do there. Nurse will do something, and what you can do is reassure, calm, make him to sit in a propped up position and stay with him. If the inhaler is there, if he is known asthmatic, we can give the puffs and shift him to the hospital or wellness room. This is in the case of breathing difficulty. Okay. Now, next is chalking. So maybe very young kids, they are eating erasers and it may go and stuck, isn't it? Chalking, what is chalking? Something is stuck in the throat. Yes. So what will happen? Inability to speak, cough, then bluish or pale skin, noisy breathing will be there because this is blocked. Then loss of consciousness, panicked or distressed behavior, and they were holding like this if something is. So what we can do in the case of this? Yes. Whether you've seen small, like babies, after they eat their food, what the mother is doing, whether you observed? Yes? Huh? Patting on the back, isn't it? So see, give the 5 back blows. Can I show you with someone? Yes? Come. No, he came. Yes, he came. Yes. No, you'll get paid. Yes, come. See, you have to hold and stand like this because something is stuck. See, if something is stuck, usually we'll hold, right? Yes, because you are doing like this. So what first we can do is, so see, hold in the right hand on his shoulder here, and you can see from the heel of the hand, this is the heel of the hand, we can give like back blows. And then I'm not hitting him hard. Okay. So what will happen is, and tell him to bend a little bit. Tell him to bend little bit. Give him back blows. So what will happen? He may cough and it will come out. That thing, what is stuck, it will come out. If it is not coming out, what we can do is abdominal thrust. That is standing like this, and one leg we have to put like this, and abdomen, see, just like ice cream scoop, how we are doing. See, hold, do it. Yes, do it. Take your right hand. Take your right hand. Yes. Then close with the other hand. Then we have to scoop the abdomen below the chest and above the abdomen. So this is the area. So what we can do, see, like this we have to do. So one of you can do for him. Sir, can you try for him? Yes, right hand. You hold and stand. You hold your neck. You do this. Close this, sir. And don't hold it tightly. Okay. Now close this. You close the cover. Then come little bit. Then you hinge, sir.
Okay.
Then you have to scoop. Ice cream scoop iruttalla ಅದೇ ತರ ಅವನು ಕಾಫ್ ಮಾಡಬೇಕು. That he should bend, and you have to bend and stand. One scoop. Yes, that is the what. Yes. So that should be done in the case of chalking. So that what will happen? whichever is stuck, whatever the material stuck, it will come out. So you understood what we can do in the case of chalking? First, back thrust, then we can do this. If you are alone, nobody is there around, what we can do? We can take a help of, yes, see, we can take a help of chair and press, then it may come out, that thing. So that is the first aid in the case of chalking. Okay. Now, this is not needed, that is heart attack, it is no. Now, next we'll move on to the seizures. Okay. So, this is very important. In the school scenario, maybe your friends, whether you observed suddenly falling and shaking of the body, whether any one of you seen among your relatives or somewhere, yes? Whether you seen? Yes. Witnessed, someone may be witnessed. What is this actually? Seizure. Any bhuta coming on them? No, right? Ghost? No, nothing. So it is not like that. Maybe some saying is there. Yes, in the olden days they are saying that what actually happening is abnormal wave of electrical activity in the brain. We have something activities going on in the brain, no need to study detail. So abnormal activity is leading to the seizures. Okay, it can be due to medical condition known as epilepsy. This seizures is coming because of the disease epilepsy, and also sometimes if the fever is high, you know, that is known as febrile convulsion. Whether you've seen very young, small kids like 1 year, 6 months, 2 years, if the fever is too high, maybe they may get convulsion or they may get this shock. That is because of the temperature, and other thing is because of this abnormal electrical activity in the brain. What we can do in the case of this? Your idea you can tell me first. Yes? Huh? Oh, no. Huh? Iron rod. Huh? In the bit. No need. That also wrong what we are doing. Or else they will let them bite. If you put that, they may stop breathing. Then let them bite. It will heal in 1 week, 4 days. Isn't it? So what we can do is, see, first aid in seizures, this is important. Okay. So stay calm and reassure. Can we make him to drag him somewhere, and can we stop holding him to stop the shaking? Can we disturb him while shaking? No. You should never make him to stop the shaking. Any first aid what you are doing is that afterwards, before that what you can do is stay calm and reassure, keep the area safe. If it is on the road, what we can do? Stop the vehicles. Yes, right. That is a first aid again. Stop the vehicle. Stop. And we can let him shake. After shaking only we can touch him. Okay. So keep the area safe. And if at all his head is near big stone or any furniture or anything, that we can support the head. Any soft material, if it is there, we can give it under his head. That is one thing. And next is get the help. That is anyway we are doing calling. Put something soft under the head. Put them into the recovery position after the shaking has shaped. So what we have to do in this case is we have to monitor the time. If possible, do video recording of his shaking. Again, that will help in the doctor. What type of shaking was going on, everything. Understood? So what you can do, time out how many minutes that shaking was there. That you can make it out. And next thing is, let the shaking finish. Then put him in the recovery position. Recovery position is, yes ma'am. Yes. Yes. No. That we cannot put anything in the mouth. Cotton, cloth. Let it bleed. And afterwards we can do something for that. Because during the shaking time, putting anything in the mouth, again what will happen is sometimes again because of that choking, breathing difficulty will be there, and this may continue also. That is, you should not do for anything for that teeth biting, and don't give any iron rods and scooter key, car key. No, it won't help. Okay, that is all sayings in the back times. If we give the iron rod, something happened to him, that's why. No. See, what will happen? Usually, after some minutes, it will stop. Then what will happen is immediately if we give the iron rod, he will stop. Then what people are thinking? Oh, because of my iron rod, he stopped it. No, actually it will stop by itself. But we should not touch him and do not do anything. And some like froths we may come from the mouth, isn't it? Yes. Some white froth, whether you observed or not. So after the shaking is done, we have to put him in the recovery position. Recovery position is side position. In the side, see, can you see the recovery position? Yes. Why we are doing that? So that it may drain outside. Otherwise, again, it may go inside and there is a chance of choking. So we are doing this to recovery position till the medical help arrives. We cannot give any medicine in this case, and we need some medical help. What we can do is stay calm, reassure, make the place safe, and put some soft things under the head, and time out, please note the time, and if possible do video recording and shift the patient to the hospital. So this is the thing we can do in the case of seizures. You understood? Yes? Okay. Now, when it will be serious, a seizure lasts longer more than 5 minutes. Usually it will be 2 minutes and all, maybe few seconds also in some cases. But it is serious if it is longer than 5 minutes. The person does not regain consciousness after 5 to 10 minutes. The person is already elder patient with diabetic, hypertension, then it is serious. The person has never had a seizure before, any life-threatening condition if it is found. That is, again, ABC means airway, breathing, circulation. If 3 are not there, then it is again emergency. Then we have to shift the patient to the hospital. Now, next is drowning. Swimming pool. Do you have swimming pool here? In the school? Yes. You like swimming, isn't it? Yes. So what we can do in the case of swimming? Hey, drowning, sorry. If you are expert. Otherwise, so what we have to check first? Scene safety. So, am I safe? Is the victim safe? Is the environment safe? Can we jump to the water? No. First, if, yes. Otherwise, we can throw the floatables if anything is there to get to help. Call immediately to the help. That thing you can do. Yes. So, next is what we can do. We can first take out the victim from the water is the first step. Isn't it? Huh? Immediately after that, what she told, bring the victim out of the water, place on their back and check the vitals. Dr. ABC, you have to check. Again, airway, breathing. If no signs of life, what we can do? Start with the CPR. If he is fine, if he is breathing, then we can put him in the recovery position. Can we press the abdomen to omit the water? No. Why? No need to do that and all. Okay, no need to again, some things is there, no, again, maybe in the movie also we are seeing, right, isn't it? But we no need to do that. If he is no breathing, no pulse, start with CPR, and if he is breathing, and then you can put him in the recovery position. And what will happen in the case of drowning is body temperature will come down. Hypothermia will be there. Hypothermia. Thermia means that body heat. Hypo means less. So what will happen? We can cover him with the blanket or any clothes and make him warm. If he is breathing all right, that is the thing. If he is not breathing, no pulse, then shift the patient, do the CPR and shift the patient to the hospital, call for the help. No first aid other than this we can do in the case of drowning. You understood? Yes? Yes or no? Yes? So any questions related to this? Can we revise? So first we'll go for bleeding. What we can do? Tapa we can tell. Yes, fast. Minor cuts?
Wash hands.
Wash hands. Apply pressure. Raise your hand. Can we put turmeric powder, chili powder, sugar, coffee powder? Yes? No, turmeric powder also not needed. Do you think will this turmeric powder, this sugar, coffee powder will arrest the bleeding? It won't help in any way. Instead, what it will do is, it will give your wound more infected next day. That if at all the wound is deep, if it needs the suturing, if you put this turmeric powder, coffee powder, it is very difficult to clean the wound in the hospital. One thing, if we clean too much also, some part of this powder will be inside and next day there is a chance of infection. So no need to put any of the powders, just apply pressure, raise your hand, the bleeding will stop. Don't think this turmeric will, see whatever turmeric we are getting in the market today, that is adulterated. Do you think it is original pure turmeric which has that antibacterial property, antiseptic property? No. So no need to put anything, just apply pressure. Okay, in the case of uncontrolled bleeding, first what we have to do? Yes, locate the bleeding. Yes, so at least somebody is answering. Yes, locate the, apply pressure, then tourniquet, and what you can raise your injury also you can do along with that and shift the patient to the hospital. Now coming to the fracture, what is that word? Rise. Okay, what is R? Rest. Immobilize. Compression, elevation. That is in the case of rise. So you know the difference? Fracture, sprain, strain. Yes. Now next what we learned? Insect bite. Yes. So insect bite and food allergy. We can consider it as a same. And what is the symptoms will be there? Rashes will be there. Swelling in the lips, swelling in the tongue, and breathing difficulty will be there. In that case, what we can do? Reassure and calm the patient. Then if we can sit him in a comfortable position or make him lie down, if breathing difficulty is not there, immediately we have to shift to the hospital. Next, in the case of no, in the case of burn, no, don't apply anything. That is all, it won't help. And if it is minor, like one or two minor swelling is there, some people are applying that turmeric or something, toothpaste. No, it is no to toothpaste. If you are very sure with the turmeric that is pure, then you can go ahead and apply. Okay. Now next is, what we learnt next? Snake bite. What is the thing we have to remember? Right. What is R? Rest. I? Immobilize. Then get to the hospital. Then tell to the doctor. That is about snake bite. Okay, next what we learnt? Burns. Yes. What we can do? Remove. Yes, 20 minutes. And if any things or any watch or any clothes we can remove. If it is stuck, don't try to remove it, because what will happen? Bleeding will be there, and get to the hospital. That is next. Next what it is? Electric shock. First thing what we have to do? Get rid of the source. Very good. So we can take the some stick or something, wooden stick, get rid, that because we have to see the scene safety. Yes, that electricity supply should be stopped, otherwise you won't be safe. And next we can do same as the burn. Next what we learnt? Breathing difficulty. Yes. What we can do? reassure and make him calm. Then, if he is non-asthmatic, we can give puff, or else we can bring him to the wellness room or to the hospital or anywhere. Now next what we learned? Choking. That you can remember, right? Choking very well. Because we had done here back blows and abdominal thrust. That is the thing you can do for as a first aid to remove. Still if it is not coming out, we can take him to the hospital. Okay, if anything goes inside the ear, can we try to take it out? No, because it may go deep inside the ear. So don't try to take it, try to pull it out unless the medical help, because they are doing some instrument it is needed for that. So you cannot do at home. So don't try to take out anything from the ear or nose. It may go deep inside and it may arrest the breathing also. Okay, next. What?
What if it is at the night?
Night you have to arrange to go for the hospital. Maybe nowadays every home one vehicle will be there, right? And even it is available whole night also vehicle in this city Bangalore. Anyway it is available. So hospitals will be open 24 hours. So we can go there and do. Yes. Next what we learn? Seizures. Seizures, you know? Can we touch him?
No.
Can we stop shaking him?
No.
And can we drag him to any place? We have to make the place safe to him to. That activity, let it finish. That shaking, let it finish. Then we can go. That is the next thing. Next what we learned? Drowning. Yes? Okay, you understood all the things? Yes. So we finished introduction of first aid and some of the common emergencies which you are in your daily life, you are coming to happen in your daily life, that we addressed. Now we are learning what is basic life support. That is knowledge and skill to give CPR. Whether you heard AED machine? No? How to give the basic life support. So analyze, see first something is happened. Maybe you can check with the electric shock. If it is there, what we are doing first? Scene safety, assess the consciousness. Do you remember this? First session we finished, Dr. ABC. Yes? What is? Check. Then call care. So we have to check the patient first with the Dr. ABC. Now next. In the under care, we are checking his AVPU, that is if he is alert, if he is responding to our voice, that is A, V, then pain, if we pinch him, is he responding, that is P, then U is unresponsive. If the victim is unresponsive, then only we can do the CPR. When we can do CPR? If no breathing, no pulse. That is the mantra of CPR. We cannot do CPR if he is breathing, if we can feel the pulse. If he is not breathing, but still pulse is there, can we do the CPR? No. CPR is only we can do no breathing, no pulse. If no breathing, only pulse is there, we can use one ambu bag. Whether you've seen ambu bag in anywhere in the movie or anywhere, you know that oxygen mask, you know, whether you've seen in the movies. So oxygen support we can give if pulse is there, no breathing. When we can do CPR? No pulse, no breathing. Unless otherwise you should not do CPR. That is cardiopulmonary resuscitation you should not do. Okay. Now, if the patient is having breathing is there, then pulse is there. But he is bit unconscious. So till the medical help arrives, we can put him in the recovery position. This is the best and comfortable position for the patients. If any patient you are waiting for the medical help to arrive. So what is this position known as? Yes.
Ma'am, in which side we should make the patient?
That is anyway, any side it is okay. Left lateral, we are telling it is more comfortable, left lateral. But sometimes what will happen is, if the fracture is on the left leg, so according to the condition, whichever side it is okay. Recovery position, left lateral, we are telling it is good. But whichever position, left or right, this is the position and we can make him to lie down in this position. Okay. Next is, when is the indication? When and all we can do CPR? In any condition, if it is cardiac arrest, if it is choking, drowning, but no breathing, no pulse. In that case only, we can do the CPR. Okay. So, no pulse, no breathing, and he is unconscious. Then we can start with CPR. Now, what is CPR? Cardiopulmonary resuscitation. See, you know our heart is beating. Is it 6th standard? Who is 6th standard here? You know our heart is, every time it is pumping and it is, the blood is going all through the body. Yes, that and all come in the science already, isn't it? Yes. So what we are doing, in the case of no breathing, no pulse, the heart is stopped working, isn't it? The electrical activity in the heart is stopped. So what we are doing? We are putting compression to the heart to make it work again. That is cardiopulmonary resuscitation. Ensure blood flow to the heart and brain, generate adequate pressure in the heart to push the blood to the brain and other important organs. What the heart itself doing, that we are trying to do till the medical help arrives, so that you can save the person. That is known as CPR. Okay. Cardiopulmonary resuscitation. No need to understand detailedly in your age, but little bit you understand what is CPR. Okay. So this is how the people are giving this. So see, how we can give CPR is, we have to make the person to lie down in the hard surface, not over the bed. What will happen if it is over the bed? That compression won't be enough to go, because that bed is there. No, that's why we won't get that compression. That is, surface should be hard surface. Then we have to kneel down like that. Our position should be like that, and our shoulder should be perpendicular, and our hand should be straight. And what is the position? Take your dominant hand. Dominant hand, which hand we are using mostly? So I am taking left hand, then lock it, then with the heel of the hand we have to give the pressure. Where? In the sternum. So position is also important. In between the ribs, one bone is there, right? Sternum. Do you know the ribs will be attached to the sternum? Yes? That also you studied above 6th standard. Yes? Yes? Backside it is attached to what? Yes, spine. It is attached to the spine. And what about two bones which is not attached? What we call as? It is there in the book. Yes. Floating bones. Yes. You understood? So that sternum we are putting the pressure, and shoulder, elbow, wrist, it should be in the vertical line, and it is back, our back should be straight, and this is the position to give the CPR. Can we do the demo for this? Can we do the demo for the live person now? No. Only we can do CPR when? When
there is no breathing, no pulse.
So, you should never do the demo. Just you can show that. That is all. Never try to do this. Please understand. When we have to do CPR, no breathing, no pulse. So never try to. If we have that mannequin or something, plastic somethings, then only we can show you. Otherwise, just theory part you can learn, that is enough. Okay. No demo, nothing. Okay. See, can you see what will happen? See, 1/3 height of the chest wall, 2 inches deep, Allow full chest recoil 100 to 120 per minute. Each cycle is 2 minutes. Each cycle will be 200 to 240. So now any doubts? Yes.
What will happen if we do CPI when the person is breathing or has pulse?
In has pulse, because already the heart is in the working condition. So if you put again pressure, it is not safe for the heart. Okay, we are putting pressure to the heart, isn't it? So you should never do while if he is breathing, the heart itself is doing the function. Then why we should support from outside? No need, right? So nose bleeding, whether you observed in the nose bleeding, yes? So what we will do?
We would make them lie down. We put them lie down. Hold the nose so that the blood.
Very good. Can we do like this? Tell him to do like this. No, right?
The blood will go down.
So what will happen? Again, choking will be there. So what we have to do in the case of nose bleeding is, tell him to bend to forward and pinch the soft part of the nose. One soft part. Can you make it out? Here up bone is there. Below one soft part. Pinch the soft part of the nose. Okay. Little time, like 3 minutes, or if you pinch. So what will happen? It won't arrest breathing. If you pinch here, will it arrest breathing? No. So tell him to put your head forward bending needed, and pinch the soft part of the nose, so that after some time the bleeding will stop. If it is not stop, then we need the medical help. And don't ever sit like this, bending your head backward and sit. Usually what the feeling we will get, if the bleeding is there, then it will stop. But bleeding will still be there. It may go inside the throat and there is a chance of choking. Okay. And now you understood nose bleeding. And one more thing is, once you reach the wellness room, you can put the ice pack. Ice pack. Because in the classroom, immediately you cannot find the ice pack. If you can bring or you can take him, yes, then you can put the ice pack.
What about if a person has a broken nose?
Broken nose. Broken bone, what you are telling is the broken bone, isn't it?
If
Ah.
a person gets punched and their...
No, what is the first aid in the case of bleeding? That is same. But later, once you go to the hospital, they'll pack with some cotton and all, they'll arrest the bleeding and will give some medicines to reduce the bleeding also. Okay, so we cannot immediately we cannot help with medicines and all. What the first aid you are doing to nosebleed, that you can do and take him to the hospital. Okay, and broken bone, some support they are giving and it will recover by itself. The bone, if it is fractured or anything. Okay. Yes, it will move by itself. If he is breathing, if he is okay, it will, the water, no need to worry. It will no need to push the water outside. Why?
Why do they push?
Because again, when it is coming, there is a chance of choking. Choking, we don't know when it will happen. It may go to the lungs also. Once we do, if the water is coming out, if it goes to the lungs, again the danger. Already he is out of danger. Then why are you making him again in the danger? Isn't it? Understood? Okay, any things? Yes? If something falls to the eyes, any small insect or the dust or anything, what will you do immediately? Blink one. Then water? Put water how? Will you splash water? No. You should never splash water. It may go deep inside then. So instead, you can take a bowl of water, bend your head, wash your eyes by blinking. Okay, understood? And if no bowl, sometimes we were outside and you can make your own bowl with hands. Then fill the water and blink and wash. Don't splash. If it is small insect, it may go inside instead of coming outside. Isn't it? Yes. So that is in the case of small insect or any dust or anything. Usually our mind, we will go and splash the water, but don't do that. Take water, bend your head and blink and wash your eyes. Okay. And don't keep on itching your eye, ear. If anything is itching, don't keep on rubbing. Okay. Then don't put any sharp objects into your ear. That and all you know right from the young kids. Yes. Even the earbud also you should not use to put inside the ear. Okay. Why earbud is there then? Yes. You can clean outside. Pinna you can clean. Don't put earbud inside your ear. That wax, no, that will clean. Your ear will clean by itself. No need of your help. If the wax is more, then you have to visit the ENT doctor, and he will take. No, don't try in the home to remove the wax, and don't tell your parents not to put the earbud into your ear. That is also not needed. Ear itself it will clean. Once the wax is dry, it will fall off. Okay.